the performance built into the performance model that we have there, to make sure that we're getting, you know, the best possible outcomes.
Yes, and working with NHS Grampian procurement and working with our performance colleagues and our contract management and central legal office, we will ensure there's effective contract monitoring and management in place. So that's both statistical data and narrative on a quarterly basis, to have designated single points of contact from both the commission provider and the partnership or the primary care service, annual reports to the IGB, and if there is any significant change in the contract and the service outcomes, the IGB will be informed.
Okay, that's good to hear. Thanks for that reassurance. Thank you.
Thanks, Martin. Then Christian.
Yes, thank you, Leon. Just to seek some reassurance that with the difficulty that you have to recruit and to retain people, that all effort will be made, whoever gets the contract, that the 26 people who are doing the service will be approached.
Yes, so the Link practitioners have been involved during the first stage of the programme review, but also throughout the collaborative commissioning process. And we've committed to engage with them on at least a monthly basis between now and the start of the contract. So this will involve written briefings, which will go out after this IGB and after the tender goes online in Public Contract Scotland on the 1st of September, and we'll commit to monthly briefings and then followed by workshop sessions. The content of these workshop sessions will depend on who the successful provider is and whether a 2P process has to be enacted, but we will commit to regular communication with Link practitioners like we have done over the past sort of 6 months or so.
Thanks, Ian. Christian, is that answering your question? Yeah, okay, thank you. Dina, okay, I'm really conscious of our time on this one, and I do want to close this paper, but if you can be quick with your final comment, that would be appreciated.
Yeah, so this is not a question, just a comment regarding the issue I raised before. It's not about getting immigration advice, it's about the barriers that immigration causes for people who want to seek this support. That's what I want to highlight. These link services, so that those are the ones that I'm trying to highlight. So there is a massive relevance to this report. So that's just a comment I wanted to put out.
Okay, thank you, Dina. My understanding, Ian, of the role of the link workers is to reduce barriers to anyone who is contacting them through the service, whatever type of barrier, whether it's mental health or their immigration status or disability of any kind. So the key bit for me would be how the staff are aware of the other supports that are around people. And I think I was hearing from Ian that diversity and inclusive approach will be something that's scrutinised. So it's not a specialist service, but it's a service that's to reduce barriers for anyone who has a barrier. So they would be people who have immigration state who don't have recourse to public funds would be able to access this service where they do if they presented, and they would be supported the same as anyone else with their individual needs. Is that a fair, very basic assumption of this service, Ian?
Yes, that's absolutely spot on. And again, equity is really, really important to us, and link practitioners are very well trained. So because they're a generalist service, but they need to have the training to be able to have meaningful conversations and make appropriate referrals to specialist organisations, and how to have conversations with different types of groups. And what we would ask all certainly successful provider do is to complete a health inequalities impact assessment as well. So we have that assurance that to look for and how to engage in these meaningful conversations.
Thanks, Ian. So I hope that clarifies that. And they would also be very trauma-informed practitioners as well, so they're aware of how to work with people who've experienced complex trauma too.
Absolutely. The link practitioners are going through that trauma-informed training right now as part of their package. It's something that we've certainly picked 3 to 6 months since our new strategic plan came in place.
Okay, thank you, Ian. Right, I'm going to move us now, conscious that we do need to have a break as well, and we have 2 more papers to get to. So our recommendations for this are on page 229, 230 of the pack. There's 4 recommendations in total, but we're seeking to approve the business case, delegate authority to extend the current contract, to extend the contract in the event of a satisfactory year 3 contract review, and then extend it beyond that. Request an update with Chief Officer's report on the outcome of the tender process later this year, and make the direction as Appendix B. And I think we can capture some of the discussions about the importance of contract monitoring and how that will be done. That there'll be an annual performance report, and that'll come through the Chief Officer's report. Should there be any significant changes following the full contract review, that we'd expect that to come to the IJB, and that we expect these workers will continue to be that inclusive role where they're able to cater for the needs of multiple different groups of people in our communities, and take a removal of barriers approach to how they work with people. So just to make sure that that's all captured in our minute of today, because I think that's really important, and to celebrate as well how good this work has been to date. We're one of the first provider IJBs to deliver this, and now it's a requirement of all IJBs to have link workers. So great to see this work progress. So thank you, Ian, and thanks for the team for taking this forward. Are we happy then to agree those recommendations? Sorry, it was a bit of a ramble, but yes, 4 recommendations there, and we'll capture the discussion in the minute. Okay, thanks, folks. Next item then, so can we go to Fast Track Cities now, Sandy? Do we have
Yes, thank
Daniela?
you, Chair.
Yep.
Daniela Brawley and Lisa Allerton are both able to join us now, so I'll maybe just hand back to them.
Hi there, thank you for letting us come and present this paper to the IJB. So I'm Daniela Brawley, I'm a consultant in sexual health and HIV and clinical lead for the sexual health service, and HIV lead for the MCN. So for those of you who aren't aware, Fast Track Cities is a global initiative to reduce HIV transmission and elimination, mostly based on cities, because that's generally where the epidemic has been focused, but there has been practice which is used out with cities, and that's what we're trying to focus on in terms of Grampian sexual health. Aberdeen was the 2nd city in Scotland to sign up to the Fast Track Cities initiative back at the beginning of 2020, and the group has continued to meet throughout the COVID pandemic, although obviously some of the work that we've been trying to do has been affected by COVID, as particularly in terms of working with partners, but we were the only group in Scotland to continue to meet during that time. Where we are just now is that the outcomes of and the aims of Fast Track Cities are to reduce HIV new diagnosis, deaths and stigma. We have achieved 90-90-90 already in Aberdeen and in Grampian, although the first 90 is still to be under review post-COVID, which is done by Public Health Scotland's data on testing. But of the people who we know are diagnosed in Aberdeen, over 99% are on treatment and 98% are undetectable. We are, however, as is detailed in our paper, still having issues, which is a chronic issue, which we're trying to address as best we can around late diagnoses, and also missed opportunities for testing. And that often is in groups who don't perceive themselves to be high risk, in inverted commas. So again, just getting that message out there about testing people for conditions which are indicators and not always relying on what a risk may or may not be interpreted to be. And we're working with partners to look at opt-out testing or increasing testing where there are symptoms or indicator conditions for HIV. Testing has, however, really been impacted by COVID. We are trying our best to make sure we can recover that testing capacity, both within specialist services and with partners, and are also looking at postal testing options with third sector agencies and also national pilots. One of the big areas is also around prevention, so that's not just condoms, but things like HIV PrEP, which has increased to beyond pre-COVID levels. And underlining all of this is stigma. stigma. So we are trying again to work with partners both within health and social care staff, but also wider educational programmes and out with those more professional networks to look at stigma both within healthcare settings and within social care, but also within our kind of public forums as well. So I'm happy to take any questions around the paper or the short presentation. Or if Lisa, you want to come in.
I see Lisa's hands up. Lisa?
That's okay. I just really wanted to fly the flag for our Positive Voice Grampian, who are a local organisation that have really championed the work that we've done throughout the pandemic, and they've continued to meet. They're absolutely instrumental in putting the action plan together, and it's had national recognition from other areas in Scotland. So it was just to add that in terms of completing the picture of Danny's comprehensive overview of the paper. But thank you.
Thanks, Lisa, and really good to highlight local groups doing great work. I'll open that up for questions or comments from people. We've got just 2 recommendations, which is to note the progress and to endorse the proposed actions, which seem very sensible to me. Does anyone have any questions for Daniela or Lisa, first of all? I'm not seeing hands up at this point. So I'm not seeing questions. I think the report was very self-explanatory, and we were, I think, well, I can speak for myself. I was very impressed with the fact that the work had carried on despite all the challenges, and that we're doing great work in this area. So thank you both for coming along and presenting today. IGB members, are you happy to note the progress on the plan and endorse the proposed actions for the year ahead, and note that we'll have an update in January 23? People are saying yes to that. Yes. Okay, thank you. So thank you, Daniela and Lisa, for coming along. Much appreciated, and I look forward to hearing how this progresses further. Okay, so our final item, Emma, please tell me if I've missed anything. I think our final item today is our Rosewell House joint evaluation report. And I see apologies from Sarah Gibbon, who's having to leave at this point, but is it yourself, Fiona, that's going to be talking to this report, or is it with Alison as well, and Julie? Lots of people around this work.
Will I start, Alison, and you can keep me right if I go wrong anywhere?
You can carry on, Fiona. On you go.
Okay. Thank you. Thanks, Alison. Thank you, Chair. I'm very mindful of time, Chair, so I'll try and keep this very short. You have the papers in front of you, so it is looking at our step up, which has probably not made the progress that we'd initially hoped in Rosewell, just being completely honest with you all. But there's definitely ongoing work to try and improve that. And I think that was, we set up a new service during a pandemic, so lots of learning for us there in our vision. But I think our vision's absolutely still there for that increase in step up, and we're doing quite a lot of work around about that. And there's definitely some learning for the wider system, how we can do that together. And I'm absolutely delighted to see the evaluation report there, because I think it really was a good opportunity to really hear from families and people that had used the resource and their staff to really understand what we need to do in the next phase of Rosewell. And that's our focus going forward. So I'm very happy that, I think the evaluation's there for everybody to see. Very happy to take any questions, because I am very mindful of time. Thank you.
Thanks, Fiona. I'll open that up. I'll maybe just start with a question while folk are maybe thinking, and it's the point you make there about step up care, and for good reason that Rosewell has been very busy with care coming from the hospital. Do you see that changing soon? Do you think it's realistic to start thinking about how our step up care could be working, or given that we're now coming into the winter period, is it going to be that we're going to need to just be using Rosewell for that step down from hospital care?
So I think very mindful that winter is rapidly approaching, but I think there'll be opportunities for alternative to admissions to hospital that we could be using Rosewell for. So traditionally they might have gone into 102, whereas absolutely Rosewell will be a different option. And that's absolutely how we're working with the teams to try and progress that. To enable us to do that. So we're going to protect a couple of beds so we can have that and try and get people using it and getting used to it, so it becomes an option that's in their mind, rather than always picking up the phone to the hospital, rather than phoning Rosewell to see what our capacity is there, but also how we work as a system to ensure people are aware of our capacity. Thanks.
Thanks, Fiona. That's helpful. John Cook.
Thanks, Lauren. Yeah, just a couple of questions. The report talks about potentially improving things like staff amenity, possibly having diagnostics on site, improvements in patient transport, supplies transport. Any kind of indication of a kind of time scale when some of those things might or might not progress?
It's the $1 million question, isn't it? And all the staff would love me to be able to direct them to that. So I think it's something that we're looking at different options. So we've been using Nerves for us to help to shift things between sites. So the voluntary motorbikes service that's available. So definite timescales, no. But what we will do, I think what we now need to do is take this through our oversight group, which will then help us just, we will be meeting with an action plan following the evaluation. We haven't met since the formal evaluations come out, and now it will be our focus going forward of how are we going to do this, how are we going to achieve it, and to understand how much this is going to cost and where we will pay between working with Bonaccord Care, because obviously this is an absolutely co-produced service that we work very closely with them to understand what they had before and what do we still need going forward.
Thanks, that's helpful. I think maybe if we could get an update in due course on some of these things, that would be helpful. Brief comment though, the report says we got this wrong, we need to improve this, we need to improve that, we need to improve this. Remind me what the award you've been nominated for is?
Oh, I'm going to get Julie in because she's going, it's the socials. Julie, which award is it?
So I think it's the Scottish Social Care Awards.
I think it'd be good if we get details of that circulated, just so we can do a bit of cheerleading for it. But again, I think I like reports that are like this, which is basically, it's a warts and all report, saying stuff does need to improve, stuff could have been better. But actually, if you look at it in the round, this is a good job done. Otherwise, you wouldn't have been nominated for the award. So well done, guys. I'm sorry, and that's the type of report I like to see. If I see a report anywhere that says everything in the garden is rosy, I kind of think, where's the bad news in? If I see a report like this, it's just more credible and helpful. So thanks.
Thank you. And they are also nominated. We haven't heard if they've been shortlisted yet for the Scottish Health Awards as well. So there's two, as I say, we don't know if we have been shortlisted for the Social Care Awards. And it is all about an integrated model that we're delivering, which is the first in Scotland. I will keep remembering and banging that drum. So we are definitely leading the way in Aberdeen. Thank you.
Thanks. And I see Claire has put in the chat what the name of the award that we've been shortlisted for. So that's very good to see. I suppose just on John's point about the areas that are clearly identified for improvement, and still more work to be done. And I always liken to close the loop, as Sandra knows. This isn't so much business as usual yet because it's still an evolving service. So will we expect to get a report back on Rosewell to the full IJB, or will that come through clinical care governance? And I suppose just agreeing a timescale today for that update would be helpful.
Thank you, Chair. So we absolutely report through our clinical care governance group as well, but very happy to take something back to the IJB in maybe 6 or 9 months, if that would be acceptable, just to let you know where we are.
I think that would be really good, but I would be led by you and the team as to the timescale for that. I don't want to create extra work and lots of reports, but it does feel like we're kind of trailblazing with Rosewell. So I think it's important the IJB remain cited on this important area. Sandra?
Was just checking. I thought it was on the planner. It's on the planner to come back in March 23. Okay. So by then we'll know more about how the step-up care has worked and the alternative to hospital and all that stuff. Yeah, that sounds good. So we can note that in a minute that we've already got that flagged for an update coming back. And on the report we were simply asked to note the joint evaluation. I think I don't have it in front of me right now, so we're happy to do that. And commend the team that have been around this. I think really important to commend the team on
the work that's gone into this, and not to underestimate the complexity of multidisciplinary working and all the challenges that Rosewell has highlighted, but really commend the team on the work and leading the way for Scotland in this new area of provision. So thank you all very much for that. Thank you, Fiona. Thank you, Julie, for joining us today. I think that brings us to the end of business. That means we can have a break now till 2 o'clock and then come back at 2 o'clock for the National Care Service seminar that we're scheduled to have then, unless there is any other business I should just check from anyone. But I think, Emma, can you check that I haven't missed anything out, because I've scribbled on my papers. We've covered all the items on the agenda, and we're good to have a break now. Yes, Emma's on the screen. Yes, John.
Yeah, do we just come back on this link, keep it open and come back on this, or what?
Yes, I think so. Would that be right, Emma? We'll use the same link.
Yes, I will stop recording now, but if you just come back on the same link, please.
Okay, so come back at 2 o'clock and yeah, have a nice break until then. Thanks everyone for your